We are really glad to have Professor Mukul, an international expert in the area of pensions and tax policy with us. So may I request Professor Asher to join in and request everybody to please welcome him. Thank you.
May I begin by thanking the organizers, Vicky, for inviting me to participate in this conference. Pension issues are attracting global anxiety by all stakeholders, and India is no exception, as we have heard already from the speakers. What I'd like to do is to try to provide a context for how do we progress towards a pension society, keeping global trends, global context in mind, and applying those to the Indian conditions and Indian situations. In the area of pensions, we need to be very clear that we don't have pension as a focus only on the financial and capital market side. We don't view it just from there and look at a broader context. So my presentation is organized, some introductory remarks, select global pension trends and context. I'll summarize India's pension characteristics and limitations, and then provide suggested measures, finally concluding remarks. So we know that particularly since May 2014 elections, the notion that social protection, broadly defined, should be an integral part of India's growth and development strategy has been increasingly accepted and being implemented in a variety of schemes that the government has promulgated. Now, India, as has been mentioned, India is rapidly aging. Our fertility rate is already 2.32 when 2.15 is the replacement rate. And by the end of this decade, India will have a replacement rate fertility. But there will be a large variation. Some states will have much below 2.15, some will have much higher, and that will create its own problems and its own challenges in terms of the way the population dynamics will work out. We need to track that very carefully. Improving longevity has been mentioned. The lower age population, there is a bulge here, and that's what we are talking about, demographic advantage. However, by 2030, that advantage will shrink, and by 2050, the single largest cohort of population in India will be women 70 years plus. And the second largest population cohort will be men to 70 years plus. So what we are finding now is that the base will continue to shrink and top will continue to be moving up. And that will be very rapid because in the case of pensions, we need 75 years as a sustainable, robust period in which systems should be sustainable. But our pace of aging is very, very quick. What is the age at which remaining life expectancy is estimated to be 15 years or more? So in 1950, for India, 55 years, but by 2015, 65. So today, the average Indian who lives to be 55 can expect a life expectancy of 80. So in all pension research, do not take life expectancy at birth. That is not relevant for designing pension systems. We need to take it at life expectancy at 55 or at whatever age that we need to. And by 2050, it will be 69. And we will be outpacing countries like Indonesia, Philippines. Ours will be higher. And that is the pace of aging that we are talking about in the country. Now, the other thing about the pension is that a lot of people look at pension in an individual scheme format. I have got NPS, is it enough? I've got Atal Pension Yojana, is it enough? Or some other scheme, the LIC life annuity or HDFC life annuity, is it enough or not? But what we need to stress is, and this is where we need to have a national pension research centers that were, and both by private industry and by the government as a whole, particularly I have been urging the regulators, PFRDA, IRDA, and others, and EPFO to take lead in this area, that each household should obtain retirement income not just from a single source, but from a variety of sources, each contributing a proportion to the retirement income. And that is what I call pension. Pension is not very narrowly defined that you accumulate and then get the annuity type regular income and just call it pension. Pension is from all sources, and that would include finding skills that will allow us to obtain 5 to 10% of the income in our retirement, even when we are 70. If you are a Gujarati, you make good khakra and bhakri and chunda, you can make living of 5 to 10% age 75. There is no reason for your retirement as such. Or if you are somebody else, you can do local context specific and earn income. Has to be, how do we encourage that? How do we make labor market flexible? How do we get EPFO to reduce the requirement rate of contribution if you are over 60 or 65 or whatever? That's a systemic view, and that is what has been lacking. We have been building silos rather than the schemes as such. Now, the welfare of the elderly depend on being able to access a bundle of services. Old people do not need money. Money is a means to buy services. So if you are not looking at the bundle of services to be provided, and in many European countries now, increasingly the annuities are designed to ensure a bundle of services, and you contribute certain amount, services will be provided. So that's how we should be looking at money. And that suggests that reducing expenditure needs in old age, concession price medicines, to me it's a pension in my broad definition, but it is not in the definition if you have too much financial market, capital market concentration. Better delivery of healthcare, Ujjwala Yojana, availability of toilets, improved water management, others that reduce your needs for expenditure, better public amenities. And this is where the elderly association should increasingly ask the government for amenities that facilitate them, to provide infrastructure, whether it is the metro or others, where there are different facilities for the elderly, railway stations, bus stations, that will improve their bundle of services rather than thinking of pension in money terms. So given, now let me look at the global pension assets. Mention was made that we are very low, and that is true. In 2015, $35 trillion was the pension asset. And what is our share there? 94 billion. Now, out of 35 trillion, if we are contributing 94 billion as of now, that is indeed too low because we are 1/6 of the global population. And therefore, at least we should be approaching 8 to 10% of the pension assets of the world. So how do we increase that? And that is our challenge. But notice that this 35 trillion is being managed around the world. And indeed, a lot of that money is in our country as well. The pension funds of other countries are investing. But it is our pension funds so far that have not been so active in our own capital markets because of our own restrictions. And this is the mindset change that's going to be needed. The CAGR, and we got to understand that it's going to be very challenging. CAGR over the 10-year period for these huge pension assets has been only 5%. Returns are very difficult to obtain now. We are in a sweet spot for a while to get higher rates of return, and we should try to ensure that this lasts as long as it does. Now, one thing about India is that we have got our pension assets are growing at 16% compared to the global 8%, and that is because of the low base. But we got to continue that particular growth to increase our share. Part that is very instructive. It says keeping promises to older people is more difficult with low returns and low growth. We are faced with that globally. That is why high growth is the most important pension initiative. Because without high growth, you don't have resources and economic security either for the young or for the old. So how do we keep on focusing on keeping growth rate high and at least not obstructing high growth? That should be part of our thinking about pensions. So what this does is to say in year 2000, if we take policy reforms become more urgent, if we got 100 as an index, the low rates and low growth has reduced this to 60, less than 60 by 54. So our retirement income is falling, and therefore, just because of these two factors. So management becomes a lot more important. A lot of the factors that were indicated become a lot more important. The interest rates peaked in the 1980s. And this chart shows you from 1960 to 2015, what has been the 10-year Treasury constant maturity rate. And you can see that peaked year, now it is low, and in some cases negative. So that creates other set of issues. 7-year asset class real rate return forecast also show that. The other thing is we have been talking about administrative fees and the fees of the distributors and so on. What we need to understand is keep this chart in mind. What this shows is the decline in value of accounts due to fees after a 40-year work career. So if you front load fees, percentage of new contributions of 1%, then your total amount at the end will decline by 1%. 10% front load fees will be 10%, 20% is 20%. But the annual management fees, percentage of account balance, if you get to 1% as the management fees, and in some cases in India they are even higher, sometimes double for some mutual funds, they will decline by 20%. So one of the ways is to try to see what innovations we can do to try to keep this at a minimum level. It has been mentioned that India's pension system is very fragmented. And this chart shows you how fragmented it is, low coverage of the population and the risk covered. If all of India's numerous pensions, even in a broader sense, related schemes, both mandatory and voluntary, are included, unlikely that more than a third of the labor force and around a quarter of the current elderly would be accessing pensions. So these shares need to increase. So pension society has to think broadly, see how cumulatively, where in 5 years we want to be now, 10 years we want to be now. We cannot say we want to get it by tomorrow or by 2025. It will be a iterative, gradual process. And this shows, let's take UK. They have been at pension for a very long time. So what I did was to dig out what is the percentage of employees that have got any pension at all, okay? And that is a narrower pension, not my broader definition, but that is only around 65, 70%. So 30%, they still are not fully pensioned society in that sense. They are also progressing. And we need to be very realistic, but have solid foundation as we progress more and more and more. So what are our key limitations? It has been mentioned. I'll mention some others. Lack of systemic perspective in integrating different components of the system. We are still thinking this scheme, that scheme, this scheme, but we are not integrating them. Insufficient professionalism, including but not limited to use of digital technology, the Provident Fund and Pension Fund institutions, outdated laws and regulations, and the civil service employment contract. Lack of uniformity in pension protection among different groups. So we have got a pension equity issue that we will increasingly need to address as we are addressing with others. We are seeing that everybody now wants good public sector public amenities. But now they will say pension is one of the amenities that we would like to have, and we can't have very large inequalities in the pension benefits and provision. How to reduce them? We can't equalize. There is no country in the world that has equalized pension benefits for all occupations, all groups of the society. But you can manage to make some differences. Needs for policy coherence and organizational coordination. And that has been a big, big problem. That organizational coordination with different ones. So one example, recently I wrote that the Atal Pension Yojana has got one type of investment guidelines, but the Varishta Bima Yojana, which the LIC does, has got a different investment guidelines. But they have guaranteed returns as well. And now what we have to see is that why two schemes very similar with two different agencies are having two different investment guidelines. So we have not thought of coherence that we need to have. Broad suggestions. While not covered in this presentation, rapid aging will require a closer coordination between pension and healthcare systems. Because if you want bundle of services, we know today a very important cause of poverty is a main income earner having a medical episode which costs quite a big amount and they are not insured. So that means that the health services, and this is why a lot of middle classes are very happy with this government for reducing cancer, other type of drugs that have been initiated, because those are lifestyle diseases which are disproportionate to that particular group. But we need to move much further, and that requires a lot of intangibles. Would you buy generic drugs from your chemist if your doctor says branded drug? That depends on whether you have trust in your chemist. If you don't trust the chemist, you don't trust that drug, you won't buy it and you will pay higher. So now your budget is reduced if there is trust. So how do we generate trust? And I think the financial industry, particularly globally, there is low level of trust in the financial sector industry globally. And we need to work in India to try to see what the financial sector industry can do to improve the level of trust by the stakeholders in them. Shifting ESIC from labor to health ministry. Why ESIC is with the labor ministry? No policy coherence. I mean, this is a health scheme, compulsory health scheme. So compulsory health scheme, why would labor department know anything about health? So we need to move to health. Raising working age to total population share implies that we have to shift the balance between preserving existing jobs and creation of new jobs towards the later. And that is another area. So notice that the pension society requires a lot of complementary reforms. Those are not easy. You have to think through. You have to do a lot of research. You have to be context specific. You have to say specifically where you want to make changes and not just generalizations as such. Greater professionalism and system-wide perspective. Modernization of the laws are needed. and refining the NPS. A lot of it has been said, including the phased withdrawal set of issues. They are working on it, as I understand. And I've given a lot of suggestions for the NPS and others to particularly NPS, how we could expand the pension population. Fourth is the communication and financial literacy initiatives that were mentioned. I'm all with it, but I think I would stress research and data gathering along with it. A lot of data are very limited. They are not there, and we need to do a lot more than what we have done in doing the actuaries, for example, are the critical to any insurance. But a lot of our insurance schemes on health and pension insurance are being levied or are being started without adequate actuarial balance. And the economies of scale, low lifetime administrative cost of the current NPS need to be sustained, and some of the distribution costs do need to be minimized, but taking into account the current limitations that there is not enough incentive to the distributors. As part of encouraging pension and health economics, I've already suggested that. So I'll just make the final remark, and that is the State Street Financial Advisors is doing research and coming up with a concept of PHI. Okay. Now, what the PHI is that PHI and all the pension industry needs to embrace it. One is purpose of the organization, shifting from process to outcome. We have been very happy से हमने कर दिया जो लिखा था वो रेगुलेशन में कर दिया वो कर दिया, but where is the outcome? तो वो process से outcome orientation, habits of stakeholders, including of officials of provident fund and pension organization. One time I was on the committees for financial literacy of the provident and pension fund trustees and regulators. In UK, US, we went to the House of Representatives, and we were told how little, even in US, the pension and fund trustees know about pensions. Their literacy is very low. It's also true in UK, and we need to increase that across the board. Incentive structures for the organizations and members. So once we start working on PHI at all organization levels, it is the organizations that deliver services. And we need to have at organization level this idea embraced, and then we'll begin to make further progress. Thank you very much.